Good morning, good morning, good morning, good morning, good morning. First of all, I want to just say thank you to Esther and Harry and everyone who was a part of making sure that I had the opportunity to be invited to this event. I'm extraordinarily honored to be able to be here and to have just a few moments to be able to speak with you all and share some thoughts with you all. But I want to know who was the person that decided it was a good idea to put me behind Vinayak. That is a hard act to follow, and I'm not even going to try. I'm not even going to try. He did a remarkable job. Let me tell you about two other individuals that did an even more remarkable job, and that is his parents, who happened to be in the audience. Could we give them a round of applause as well? I had the great privilege of being able to meet his father actually at the CACA conference. We met just very, very briefly after Vinayak gave another rousing speech at the CACA conference in Washington, D.C. And you all have raised a remarkable young man who is going to do some remarkable things. And he is just a representative of all the remarkable young people that are here today. And so I say thank you to you all. I say thank you to everybody. I just want to be able to share just a couple of thoughts with you all before I go. And if this works, y'all can hear me? I'm good? Here's the thing. This is a remarkable day. This is a remarkable moment. This is a remarkable opportunity. And I want to start off simply by sharing with you a quote. And this is from a gentleman by the name of Simon Sinek, and some of you may know that name, but he is one of the leading leadership gurus in our nation right now. And one of the thoughts that he shared, I think, has great resonance for who we are and what it is that we're choosing to do and what it is that we're trying to be. He says, people don't buy what you do, they buy why you do it. And the thing that resonates with me around that is the fact that we're really, really good at sometimes expressing the what's that we do, right? We got the 5 phases of this and the 7 steps for that. But we have a hard time articulating and compelling folks to understand the reason why we do what we do. If we can find out how to connect with people who believe what we believe, we might do a better job at that. And quite frankly, that caused me to think, what is it that we believe as preventionists? I'm a preventionist. I stand here proudly and share with you that I'm a preventionist. And what does that mean? That means I believe 3 things. 1, I believe that the most effective way to stop a problem is to prevent it from starting in the first place. 2, I believe in the full engagement and empowerment of the community to be a part of not only understanding that problem, but be a part of solving that problem. And 3, I believe in the opportunity to make sure that we're guided by science in order to produce population level change. That's who we are. That's the core of this day. That's what this day is all about. But why does it matter? And I'm going to tell you why it matters. If you look at this map, I had the opportunity of working with the Drug Enforcement Administration on an initiative called DEA 360 program about the opioid crisis. And this map shares with you just a pictorial display of the saturation of prescription opioids in our nation, right? And without going into great detail, just basically everywhere you see purple is in trouble, right? And so there's a lot of purple on this map. And I'm gonna tell you what that caused for me, because something happened for me in the last several years that actually radically changed the way I view things. If I view this as my house, I have to tell you that in my house, in my household, I've had a radical change. And that radical change is that my wife and I became grandparents for the very first time, right? And my son and his wife gave us our first grandchild, our grandson, Ethan, right? And then 10 days later, my daughter gave birth to twins. And I don't know how many of y'all, I don't know how y'all do it down here in Georgia, but that's right. If you're doing the math, I went from 0 to 3 in 10 days, right? And let me tell you what that means. As a grandparent, right? There's a secret that I'm going to share with you that every grandparent in here knows. Listen, that every grandparent in here knows. And that is that God gives you a present that you can't open until you're a grandparent. And when you become a grandparent, you open it up and you find out that there's a whole level of love that you never even knew existed, right? It has radically changed the way I view everything. When I go to visit my grandchildren's home, they call me Babu. That's Swahili for grandfather, right? And so when Babu shows up, I'm expecting the heavens to open up. I'm expecting the trumpets to blare, right? Because Babu showed up. But let me show you what happens. I go to my kids' home and I find that even though I have a couple of degrees, I can't figure out how to open up that daggone thing and navigate the steps. I'm hungry for a snack, and I can't figure out how to open up the daggone cabinets when I get into the kitchen, and I can't call anybody because my phone, I can't figure out how to charge my phone and plug my phone in, and I don't mean to be rude or crude, but I'm over 50, and there's just some places in the house I just don't think should ever be restricted. But here's the point that I'm trying to make. Who's the priority in this house? Is it Babu? Who's the priority in this house? The babies are the priority in this house. Is there any doubt who the priority is in this house? Absolutely none. There's no doubt who the priority is in this house. Who's the priority in this house? Because what I'm going to tell you is that it is not clear at all. And here's the message of prevention. Prevention is about identifying the most vulnerable population and identifying where they are most vulnerable. In other words, the environments that place them at greatest risk. Prevention should be obvious, right? Just like that gate at the top of the stairs, that's an invisible danger until you make that invisible danger obvious. The job of prevention is to take the invisible dangers and make them obvious. Does that make sense to anybody here in the room? This is what the day is really about, because here's the reality. We have to do this across the lifespan of our young people's lives. This is real stuff that you're working on, and in a very real sense, this is what today is all about, because here in this great state, this is what you're doing. You have peer-assisted transition projects going on in which you're helping young people being paired up with older young people. I think maybe some of you all might be a part of that, but helping to lead young people through some important transitional periods. You have programs that are associated with underage drinking, looking at how you might be able to mitigate the harms associated to prescription drug misuse. You are building upon that by making sure that we're reaching out beyond generations. You're looking at how we're stopping alcohol from being a threat in our communities to our young people. You're engaging the community in how to promote these efforts over across, utilizing specialized media to be able to do that. And you have this remarkable program that I had the privilege of working with across the nation called the Drug-Free Community Support Program, which the NIACS Coalition is actually a beneficiary of. You all here in the great state of Georgia are doing some remarkable things through the council and through efforts like V4P, which is what it is that you all are doing. You're building bridges of connection. And you're building bridges of connection during a time where at no other time in our society have we ever had public health and criminal justice coming into contact with each other. Does that make sense to anybody? And what I'm sharing with you is that the cornerstone of this bridge is you. It's prevention. This is the reason for today. This is what it is that we have to contend with, what it is that we have to do, because we are living in what Dr. King would refer to as a fiercely urgent now. This is the reality. Whether we're talking about the overdose crisis, the opioid epidemic, whether we're talking about the literally growing debate that we are having to engage with across our nation around legalization, or the fact that there's a growing voice that is trying to promote hallucinogens as medication, right? Overseas, we are being inducted by new psychoactive substances that are having some devastating effects on us, like bath salts that are incurred in our communities. I don't have to say anything about the connection between the rising challenges associated with meth and cocaine and synthetic opioids, right? We know too far how devastating that is. And can anybody remember when all we were really trying to focus on was the vaping crisis that we were seeing affecting our young people? Right. And guess what? All of that was before the pandemic, right? And as we are looking at this, what I want to share with you very, very briefly about this is that we were starting to make some things happen. We were starting to actually see some real progress being made. But since the pandemic, that trend is going in an unwanted direction, and in a devastatingly unwanted direction. In fact, in just this last year, we've seen the greatest surge of overdose deaths that our nation has ever recorded. I believe we're going to come well over 100,000 deaths just this past year associated with overdoses, right? So, I don't care what you're talking about. Every aspect of our work has been impacted by the current state that we are currently in. We are living in a very fiercely urgent now. So what is it that we can do with respect to this? One thing that we have to do is that not every community is being impacted about this in the exact same way. So we have to be attentive. We have to expand our vocabulary. We have to understand what does it mean when we talk about disparities and behavioral health disparities as being differences in outcomes and differences in services. This is something that Vinayak just brought up. We have to be able to attend to these things because guess what? Even though we may all be in the same storm, on the same ocean, in the same predicament, we're not all in the same boats, right? And so we have to be attentive to how can we support the efforts that are going on. And so I'm going to share with you just a couple of thoughts, and then I'm going to be out of your way, right? These are all based upon some work that I was able to do as I was working and helping to support some of the efforts that are across the nation with several federal agencies, including the Drug Enforcement Administration as we were doing this. And this is just lessons I learned. I just want to show you a picture and get your thought about this picture. I was working with a county, and this is after that county had found out that the overdose deaths were going in a very unwanted direction, right? And you can tell I've lived in the Washington, D.C. area far too long because I started redacting everything. So don't mind that. But if you look at the picture, right, can anybody tell me, this is the leading county prosecutor in this county, right, who called together a meeting because the overdose deaths in that county were surging, which is a fiercely urgent issue. Can anybody tell me what's wrong with the picture? Say it louder. Nobody's there, right? Anybody else see anything else wrong? Say what? No diversity in the room, right? Here's what's even worse, right? I happen to know that this woman actually works for that man, so it's actually even worse than it looks, right? Here's the piece. Who's responsible for ensuring that those seats were filled? Is it about the fact that those folks just didn't care? Or is the ownership upon those of us who know that we are living in fiercely urgent times to make sure that we are conveying a very different kind of message and a very different kind of focus? We have to now begin to focus on engagement because As preventionists, we've been really good at these first three steps, right? Defining the problem, identifying risk factors and protective factors. Vinayak was speaking about the great work that he's learned around doing that, looking at how do we translate that into a comprehensive set of strategies. But can anybody see that there's an actual fourth step in this public health approach? And that fourth step is where the rubber meets the road. That fourth step is exactly where we need to be. How do we ensure that great science is now diffused and adopted in our communities in a way that matters, right? So for those of you who are here as a part of Advocacy Day, I'm going to offer 4 ways and 4 ideas about this, right? Very, very quickly, here's what we're going to do. 1, I think these are vulnerabilities, but I think that they can be turned into opportunities for us. 1, we have to become clear in the way we communicate, right? 2, I think there is real opportunity for us to confront the realities of commercialization and the myths around marijuana and polysubstance misuse. 3, I think we need to be able to look and explore the potential of youth leadership in a way that matters. And lastly, we have to be able to do that in a way of engaging effectively and equitably in our communities. So, a couple of ideas about how we do this. And somebody tell me when I have about 5 minutes, all right? Let me know when I got 5 minutes. Just get up and start doing jumping jacks or something, all right? Here's what I'm gonna share, right? Communicating with clarity. Somebody tell me, which way is this cat going? Cat going down? You got down, up, down, up. What you got? Let me tell you. The cat's going whichever way I decide it's going, all right? Right? Right. Exactly. What's the reason why I did that? I did that because it's about perception. And perception defines what you communicate, right? Let me show you another picture. This is a graph that shows you a chart, and if you look at the different colored lines represent different substances, and the use of those different substances by high school seniors in the past 30 days, right? From the mid-'70s all the way through to today. And if you look at just the trend, just look at the direction in which the lines are going, right? They're going down. They're going in a very positive direction, right? That's good stuff. That's the result of your work. That's the result of advocacy efforts like today. Except if you look at that green line, which is ironically representing marijuana, right? And there's a reason why that started to go in an unwanted direction lately. And what I will share with you is that when we look at the inverse of the question, when we look at no use, those young people in the 12th grade that said, I am not using anything, right? Not using anything. Look at the direction in which that line is going. It is going in an extraordinary positive direction, which means the fact that most of our young people are not engaged in substance misuse, right? And if you don't hear anything else that I'm saying today, what I'm sharing with you is that the real result and real efforts that we're trying to get involved with is to make sure that those lines continue to go in this direction. This is all good news. This is all good efforts. This is all the results of your great work. And what it is that we have to do is we have to recognize that we have to do that in a very smart and strategic way. And so in order to share that, I'm going to share this real thought with you, all right? Hamjambo. Habari yenu? Ni vizuri sana kuwa nyumbani. Ninyi ni watu vizuri. Mungu awabariki. Mambo sawa sawa. Mambo sawa sawa. Oh, come on, mambo sawa sawa, y'all. There ain't a mambo or a mama sawa in a bunch. All right, so anybody recognize, you might not recognize what I said, but did anybody recognize the language that I was speaking? That was Swahili. Exactly right. I'm the very first person in my family that had the opportunity of going back and not only touching the continent, but working deeply in the continent. And I found I had a propensity for a language I had never heard before. So what I said hello, I said, how are you? I said, you all look beautiful to me. Forgive me, brothers, I was saying beautiful, but you get, I'm talking handsome too, right? I said, thank you for making me feel at home. I'm excited, let's get started. I'm excited, let's get started. I'm excited, let's get started. Was there anything wrong with what I said? No. But it didn't elicit the response that I was looking for. Why? Because you couldn't understand what I was sharing, right? As we're trying to engage our state in this phenomenal, urgent work of prevention, there is no shortage of folks that are wanting to be a part of this. But what I will say to you is that when they come to us and they're asking us how can they be involved, here's what we say. You can be involved by understanding the strategic prevention framework, right? Which is this 5-phase process. And if you like that 5-phase process, I got another 5-phase process called community state care. And if you like that 5-phase process, I got another one called collective impact. And if you like that one, then I have another one. You have to understand the social ecological model, and that social ecological model is guided by the social development strategy, and the social development strategy is actually linked to the social ecological model, and that social ecological model has to have an asset-based community development process, and if you understand that, then you know the 40 developmental assets, and 40 developmental assets has to be informed by the social investment strategy, and that social investment strategy has to be determined by the social determinants of health. You can't do anything without the social determinants of health. And that means that you also have to understand screening, brief intervention, and referral to treatment. And if you understand all that, then you can understand health and all policies. And if you understand all of that, then you understand that you have to put all of that into context.
Great.
Right? Right? So what is it that we have to do as we are engaged in this work? Is we have to understand how to make sure that we are clarifying the role of preventionists in this work. And what I'll share with you is that we have to do so by making sure that we are translating and clarifying, which means we're helping communities to prioritize well. We have to make sure that we're helping folks to understand how to focus locally, which means that we're concretizing the efforts and the works in ways that matter to folks. We have to be able to define our strategic leverage and make sure that they're able to strategize effectively, and lastly, engage equitably. And what I will share with you is I'm going to share 2 more thoughts, and then I'm going to get out of your way. The issue around marijuana is very, very clear. It is becoming the most misused substance in our nation as of today. The growth of that and its relevance to other substance misuse, is clear and it's evidence. This is from the Substance Abuse and Mental Health Services Administration. And what you will see here is that the red indicates where there's no past year of marijuana use, the blue indicates where there was any past year of marijuana use, and the green represents where there is past use, either daily use or almost daily marijuana use, associated with other substances like opioid misuse. In other words, the more they were engaged with marijuana, the more they were engaged in opioid misuse. The more they were engaged in heavy alcohol, the more they were engaged in marijuana. The more they were engaged in marijuana, the more they were engaged in cocaine use. If you look down here, the more they were engaged in marijuana, the higher the indices of major depressive episodes also being associated with this. And what I will share with you is that this is not merely about marijuana, even though I'm using marijuana. If I change this to alcohol, it would show the exact same thing. If I change this to cigarettes, it would show the exact same thing. Our country doesn't have an opioid crisis. Our country has a polysubstance misuse crisis. Does that make sense to anybody here in the room? And so the message that we have to be clear about is to help folks understand that we have a polysubstance crisis. No one is using just one thing. If they're using multiple substances. And so we have to be thoughtful about this. I was walking in New York City, and I came across this truck, brightly colored truck, right? And as I'm walking by, this lovely lady stuck her head out, right? And here's what she said. She said, "Hey, guy, don't be shy. Come get high. I got your gummies, I got your candies, I got your lollipops. Don't be shy. Come get high." I looked at her, I said, "Can I take your picture?" Nothing that this truck is selling has a THC value that would get anybody high because they're actually selling a lie, right? But how many of you agree with me that getting people high is not the goal of this truck? Somebody tell me what the goal of this truck is. Somebody. Say it aloud. Normalization. Everybody hear that? Because when you normalize something, you make it invisible, right? How many of you agree with me that some 10 years ago, a site like this would have been actually unheard of, even in New York City, right? But when you normalize something, it becomes invisible. I was walking in New York City just the other day on Valentine's Day with my wife, right? And not only were these trucks out there, but they actually had tables now, and tables that were selling edibles on the tables, just like any other vendor was selling hats and scarves. There were edibles. Normalization makes the visible invisible. Prevention has to make the invisible and make it visible. Does that make sense? I'm sorry, I may have messed that up. Prevention makes the invisible and has to make the invisible visible. And that's what the goal is. That's what we have to do. So we have to help folks understand that when we're talking about marijuana, we're not talking about that. We're talking about this. We're talking about a $50 billion industry. And what's the difference? The difference is potency, for one, right? We have to make sure that we're understanding that there is a issue around potency with respect to this unregulated field. Two, the delivery system. All the science suggests that if you change the delivery mechanisms of any substance, that substance will increase in its misuse. Does that make sense to anybody? Right? And so we have different methods that are being involved. Vaping is also a part of the issue. Synthetics is also a part of the issue. There is a huge danger, just like the top of the steps for my grandchildren is an invisible danger that needed to be made blatantly obvious. There are some invisible dangers in our children's lives, in front of our children, that we have to begin to make obvious. With that, the greatest champions for leading this cause can't be me, can't be anybody in a three-piece suit. Do you hear what I'm saying? If you don't know how to do the latest TikTok dance, you don't need to be in the game, right? How do we make sure that leaders like Vinayak, leaders like every young person that's on, leaders like the young man that introduced me and the young woman that introduced Vinayak, how do we make sure that we are able to pass the ball to them, allow them to move forward, allow them to bring their creativity so that they might be able to show us how to do this thing even better? That's what it is that we need to be able to do. And lastly, if we're going to do that, we have to do that in an equitable way, an equitable fashion, which means that we have to be able to do it in such a way that we're valuing all individuals and all populations, that we're recognizing and ensuring that we're paying attention to the fact that there are indeed some historical injustices that we have to contend with. There is a reason why if you go into some communities and talk about the opioid crisis, you're talking about a very different issue than if you're going into other communities talking about that same challenge, right? Because we have to recognize that there are differences in the historical injustices that have happened with respect to many of our communities, and we need to be able to provide resources in a way that matters, right? Health disparities will be eliminated when health equity is achieved. That has to be the aim, that has to be the goal, and so I'm going to end with this. Everybody should have an opportunity of meeting their heroes, and I am so grateful that I had the opportunity of not only meeting mine, but to spend a little bit of time with him. And he shared a thought that has become very popular. And what he stated is that ours is not the struggle of a lifetime or maybe even several lifetimes, but each and every one of us in every generation has to do our part. That's you. It's you. We all got to figure out how to do our part in this. So how do we get into good trouble? One, we can convey a message, a very clear message of how to prevent use of any and all drugs during adolescence, right? That's a very clean, very simple message. Is there anybody in this room that agrees with that message? Right? Is that something that we might be able to take on and advocate for? Right? 2, we have to challenge the myths and educate the realities of commercialized marijuana and polysubstance misuse. We have to be able to engage parents and foster parental disapproval for youth. There are many things we can do, but the most important thing that we have to do is begin to make prevention obvious everywhere we go. Will you help me in doing that? I'm trying to do that everywhere I go. I'm trying to do that all across the nation. Would you help me in being able to do that here in this state? And let me tell you why that is important for me. That is important to me because this is Ethan, and here are the twins. I know, right? That's Valentina. That's Carmen. They live here. They're in your house. I'm counting on you to help protect the home and prioritize my grandchildren, who are the most precious things to me, because they're in your care. Will you help me to do that? With that being said, thank you all very, very much for your time and for your effort. Thank you for who you choose to be. Thank you for the heroes that you've chosen to be. Thank you for this opportunity. God bless you all.